Hypertension, also known as high blood pressure, is a condition in which the force of blood against the walls of the arteries is consistently too high. It is often referred to as a silent killer, because it usually does not have any noticeable symptoms but can lead to serious health consequences if left untreated. The exact cause of hypertension is often unknown, but there are several risk factors that can contribute to its development. Some of the common causes and risk factors of hypertension include lifestyle factors. Unhealthy lifestyle habits such as a diet high in sodium, low intake of potassium-rich foods, lack of physical activity, excessive alcohol consumption, smoking, and chronic stress can increase the risk of developing hypertension. Genetics. Family history of hypertension can increase the risk of developing the condition. If your parents or close relatives have hypertension, you may be at a higher risk of developing it as well. Age. The risk of hypertension increases with age. As people get older, the arteries tend to become less flexible, which can lead to an increase in blood pressure. Medical conditions. Certain medical conditions such as diabetes, kidney disease, hormonal disorders, such as thyroid or adrenal gland disorders, and sleep apnea can increase the risk of developing hypertension. Medications. Some medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, decongestants, and certain prescription medications, can cause an increase in blood pressure. The side effects of hypertension can be serious and include cardiovascular complications. Hypertension can increase the risk of developing heart disease, heart attack, stroke, and other cardiovascular conditions. Organ damage. Persistent high blood pressure can damage blood vessels and organs such as the kidneys, eyes, brain, and arteries, leading to organ damage and dysfunction. Vision problems. Hypertension can cause damage to the blood vessels in the eyes, leading to vision problems or even blindness. Cognitive decline. Chronic hypertension has been associated with an increased risk of cognitive decline and dementia in older adults. Pregnancy complications. Hypertension during pregnancy, also known as gestational hypertension, can increase the risk of complications such as preeclampsia, premature birth, and low birth weight in newborns. The management of hypertension typically involves a combination of lifestyle modifications and medication, depending on the severity of the condition. Some strategies for managing hypertension include lifestyle modifications. Adopting a healthy lifestyle can help manage hypertension. This includes maintaining a healthy diet that is low in sodium and high in fruits, vegetables, whole grains, and lean proteins. Regular physical activity, such as brisk walking or other aerobic exercises, can also help lower blood pressure. Limiting alcohol intake, quitting smoking, and managing stress through relaxation techniques, such as meditation or yoga, can also be beneficial. Medication. Several classes of medications are available to treat hypertension, including diuretics, angiotensin-converting enzyme, ACE, inhibitors, angiotensin II receptor blockers, ARBs, beta blockers, calcium channel blockers, and others. These medications work by relaxing blood vessels, reducing the amount of fluid in the body, or blocking certain hormones that raise blood pressure. The choice of medication and dosage will depend on the severity of hypertension and other individual factors, and should be prescribed by a qualified healthcare professional. Regular monitoring. Regular blood pressure monitoring is important in managing hypertension. Monitoring blood pressure at home with a home blood pressure monitor and keeping a record of the readings can help in tracking progress and making adjustments to the treatment plan as needed. Weight management. Maintaining a healthy weight through a balanced diet and regular physical activity can help in managing hypertension. Losing weight if overweight or obese can significantly lower blood pressure.